Well, good morning, everyone. And once again, welcome to another live this morning. And hope you're having a great start to your day. Hope you've had your coffee. I am. Okay. Let's see if we can say hello to a few folks here. When you get your notifications, here they go. Okay. Let me see here. If we got here we are. Okay, let's go. I'm going to go. Nick is watching from our staff. Rosa from Montreal. Janice, Maryland, Nativity, good morning. Sue, Karen, how are you from Peterborough? Rosalinda, Niagara Falls. Francis Marie. Faye, how are you? Rita, Janine, Dave from Cardiff, Sandy, Vancouver, Washington, Marla, how are you? Wendy, good morning. Judy, how is you? Irene, Colleen, we appreciate it very much you're coming on. Diane from Thunder Bay. Let's see if Brahim comes on. Douglas, Rose, Yvonne, how are you? Mary, Labor Day. Happy Labor Day from Anaheim, California. You for sure, Mary. Dale, Jeanette, Kapuskasing, Frida, Francis, Brandon. Good morning from Craig and Darla in Indiana. How are you guys? Luella, West Tennessee. Margie from Kansas. Sully from Petawawa. Douglas, Wanda. Hi, Wanda. How are you from Virginia? Lori, Deb from Timmins. Milika, Stouffville. Judy, good morning to you. Thanks for coming on, guys. Marlene, Port aux Basques, Newfoundland. Ann, Bethany, Cindy, Saskatchewan. You're having your first cup of coffee, eh? Well, this is number 2. Cindy, Dennis, Dorothy, Sharon, Kristen, Heather from Miramichi. Denise, Oakville, Sandy. Sandy's saying, happy birthday, Rose. Cavalieri. Well, happy birthday, Rose. Kristen, Danny, Derek, Ann. Thanks for coming on, guys. Christina, we love you guys. Patricia from Florida. Sharon says she hears thunder. And Catherine, Springdale, Newfoundland. Sandy saying happy birthday to Rose. Yeah, if it's your birthday, let me know. Hi, Chaz. I think I got a question from you. Maryland, Fran, Orangeville, another Patricia, Evelyn, Deb. Guys, thanks for coming on. So Q&A Monday. Q&A Monday. Okay? We appreciate it. I had a question the other day, and it wasn't on Q&A, but it came on afterwards. Someone was asking about methylated vitamins. Okay? Now, this is only recent, believe me when I tell you this. Okay? This is more recent. And I have answered before, but I'll answer again. Okay? If you have what they call the mother gene, okay? I don't know if they pronounce it like that, but they tell you, well, then all of your vitamins need to be methylated, okay? Otherwise, they're not going to break down. Otherwise, you're not going to absorb vitamins. Guys, I can tell you that's patently false. Patently false. I'll tell you why. Because over the years, even with people that had for example, that test done and they found out that they had that gene, I could elevate their B12. Now, I used methylated B12. That's the methylcobalamin, which is the best B12. But I could use magnesium and elevate their magnesium levels. I could use omega-3 that wasn't methylated. I could elevate their omega-3 levels. I could use vitamin D. It wasn't methylated, and I could elevate their vitamin D levels. What you could measure, I could elevate. And I just tell people, look, if you got a few people on the internet that are saying a certain thing, I want you to investigate it. I want you guys to use your brain. I mean it. And I'm going to give you my opinion on years and years of experience and years in a clinical setting. I don't buy it. Okay? I heard about it. I've looked at it. You want to get tested? Go get tested. I got no problem with it. But every vitamin's got to be a methylated vitamin. That's not true. I've never seen it. It's not my experience. Anywho, somebody asked about that the other day. And they actually accused me because they said, Dr. Martin, not answering. Well, gee, every question I get, guys, I try and answer it. I don't try and avoid questions. You know me. And by the way, on a podcast, a lot easier than when I had my radio show, we didn't even filter out the calls. Ask anything you want. Sometimes I told you, I don't know. I've got to investigate it. I actually did that. I don't know. I haven't had any experience with it. I answered that a lot of times. If I haven't had any experience with it, yes, it's mostly rare, but I'd say, well, here's what I know about it, but otherwise, I'm limited to give you information on it. Okay? Anyway. Kadiro is, I think, how you pronounce that. My family doctor called me and said I have hyperthyroidism because their TSH numbers were high. I don't have any symptoms. Well, when it comes to thyroid, symptoms trump blood work. So, Kadiro, I don't even know if I'm pronouncing your name right. I wouldn't be too worried if you're not getting symptoms of hyperthyroidism, like goiter, or your eyes are bulging out, and you have maybe even a tremor, and you're all wound up, and you're losing weight rapidly. Those are signs of hyperthyroidism. Okay? But if you're not getting those symptoms, I wouldn't worry about it too much. I really wouldn't. And that's the answer. Because numbers sometimes, like TSH, I got a sort of secret sauce with TSH just based on all the years I was in practice and looked at blood work for a half a century. TSH, well, like I said, I had a little bit of a secret sauce I use for numbers, but when you came into my office, you answered a questionnaire on thyroid. And I'll tell you, symptoms always trumped the blood work. I looked at blood work, but that didn't give me the biggest indication with thyroid. Your symptoms do. Okay, Elaine. Cat scratch fever. She got that. Okay. I've been suffering with symptoms for the past year. Stiff joints, especially in my feet, burning soles, worse in morning and night. Pain has progressed to my fingers. She was on, when she first got it, 5 days of antibiotics, but still problems. Well, you could have a lingering low-grade infection, okay? And I would get at it. Probiotics, Elaine, and I would go high dose for a month. I'd take up to about 6 probiotics a day. You need to get on oil of oregano. Taking that 3 or 4 drops of oil of oregano twice a day. Get aggressive. Get aggressive. From a natural standpoint, you got a good chance you're going to resolve this. Okay? I'd have you on high DHA for your inflammation too, and curcumin. Okay, thank you, Elaine. We appreciate it. Oh, there's Thomas. He got stung by a yellow jacket. Yeah, that must have hurt. Blew my arm up like a balloon. I was afraid of getting cellulitis. Yeah, well, you got to be careful on that for sure. They tell you to take an antihistamine. Yes, okay. And cold compress. Since I do not like taking over-the-counter drugs, I like to know what to do. Well, if you want to do it from a natural standpoint, I would have you on quercetin. Because quercetin, Navitol 2, the pine bark extract, are natural antihistamines. I like the combination of the both. People that have allergies and that, I had them on for years and years and years, quercetin and pine bark extract, Navitol. Okay? That's what I would do, Thomas. Use the oil of oregano internally and externally on your arm. Very anti-inflammatory. Okay? Marie asking about cellulitis in the leg. Well, if you got cellulitis, I recommend an antibiotic. Okay? An antibiotic. Like, you know, I don't know how many times I saw this in my office and I'd say, man, you got cellulitis. Or people would send me a picture of their foot or their leg or their arm or their finger or whatever. I said, you're starting to get cellulitis. And that can be catastrophic. Why? Because it can turn to sepsis. So I'm big on, look, antibiotics in the long run, there's big problems. But if you got a cellulitis, that's where antibiotics, sometimes you have no choice. Now, I do the natural too, because even when you're taking an antibiotic, you know me, I always talk about replacing, because an antibiotic is going to wipe out all your good bacteria. It kills the bad, but it wipes out the good. And you need to take a probiotic and take lots of it to replenish your good bacteria so that you don't get a dysbiosis. You don't get an overgrowth of fungus or yeast. That happens a lot after antibiotics. And it'll end up in your bladder and it'll end up in your lungs. It can end up in your sinuses, that fungus, because you're not replacing the good bacteria. Okay, so broad spectrum probiotics. If you're asking me about cellulitis, I don't know how many people over the years I said, you need to get on an antibiotic, get to an emergency room or a walk-in clinic or whatever. You need an antibiotic if you got cellulitis, and don't fool around, because that can turn sepsis. Okay, thank you. That was Marie. Sherry is saying she cannot tolerate magnesium by mouth. Well, you're, Sherry, part of a small group. Okay, I've seen it before. okay? I can't tolerate magnesium. And usually if I flip, like some people couldn't take citrate. It bothered their stomach. You know what I mean? It bothered their bowel. And I would flip them to bisglycinate. Bisglycinate. I don't know how you pronounce it, and who cares? But Sherry is saying she can't tolerate it. What do you do to get magnesium? Well, you already said you do this. You take Epsom salt baths. Okay, well, you're getting magnesium. You're not going to get as much as you're going to get in a capsule, but you're still getting magnesium. You can use a magnesium rub. You can actually get creams you put right on your skin. Again, you're not going to get the amount that you would get in orally, okay? But doing if you can't tolerate it, don't worry about it. Take Epsom salt baths. They're very good for you. You might get a magnesium cream and use that. Rub it in on your legs or your wrists and rub that cream. Like I said, you'll never get like 500 milligrams of magnesium doing that, but you're going to get some magnesium, and that's what I recommend you do. Okay, thank you very much, Sherry. Claudette, I'm having knee surgery. Well, if you're having knee surgery, here's what you need to do. I'm glad you asked this question because a lot of people ask me. I'm going in for surgery. What do I do? Broad spectrum probiotics. You need that. Get your bacteria ready to fight for you so that you don't get any, while you're going to a hospital. C. difficile. The best probiotics oil of oregano. Get ready. Get your body ready. Okay? Really important. And after the surgery, big time probiotics. Okay? Big time. You need that. It's amazing how much better you will do. And you know what, guys? You can never go wrong. You're going into surgery. I'm a big guy because it's very anti-inflammatory. I would have you on high doses of vitamin D because it's very anti-inflammatory and it's very good for your immune system. So jack up your vitamin D before and post surgery. Jack up your vitamin D. I've given patients, recommended patients do the hammer of vitamin D before and after. Like, 20 to 50,000 IUs 3 days before and 3 days post surgery. I mean, those were little tricks that I had. And people found they healed a lot better. I got them on the high DHA right after the surgery, and they did a lot better. They healed up faster. Okay? Navitol, very anti-inflammatory. Helps with recovery. That's what I would do, Claudette. Thank you for the questions. Chaz, how is both the subcutaneous fat and visceral fat eliminated from the body? Can you remove fat too quickly? Well, look. Too quickly, look, if you starve, okay? You starve and you don't eat, you're going to lose muscle and fat. What I always tell people to do, don't lose muscle. You want to keep your muscle. That's why you want to eat protein. If you eat enough protein, you hold on to your muscle, especially so if you're on a weight loss program, and we did this in our office for years, always optimize your protein, eggs, meat, and cheese. This way, with no carbs or very little carbs. This way, you're burning fat. Your body is putting fat on the furnace for fuel. They're called ketones. That's how you burn it off in a healthy way. It's very good for you. Okay, I'm not suggesting everyone has to be in ketosis forever, but that's what you're doing. You're putting fat on the fuel. But the best way, some people, you can get into ketosis by not eating. You don't want that. You don't want that. That's not sustainable. Now, you can do some intermittent fasting. I'm not against that. But I'm just saying, your body will switch fuel if you eat the right fuel. I'm not big at all on keto. I don't like it. I'll tell you why I don't like keto. Because the food industry got involved and they made keto foods. And they're a bunch of crap. It's a bunch of crap. I don't like that. Yeah, it's got low carb, but it's got, a lot of them are just poorly processed foods. I don't like that. I don't like keto eating. You don't hear me talking about it. I like eating eggs. Okay? If you just ate eggs for two days, you'll be into ketosis. If you just eat eggs and meat for a few days, you'll be into ketosis. What's that mean? Your body is burning ketones. It's burning fat as fuel. It's not burning carbs. Why? Because you haven't eaten any carbs. Now, again, guys, like the carnivore diet and all that, it's all right if you want to do it. I got no problem with carnivore. The thing with me is I want to be sustainivore. What? I want to be sustainivore. Something that you will sustain. What's that mean? Well, that's low carb, but not no carb. I'm no carb for 30 days. And then I want you to have some carbs. Not that you need them, it's just I want you to sustain a lifestyle change. You learn that at 30 days. I had tens of thousands of patients tell me this. You know what, doc? Here's what they told me. They didn't even have to finish the reset, but they knew it before. You know what I found out? Me and carbs, we don't get along that well. I have a piece of bread. I realize I don't need that. I don't process that very well. I had to learn a lesson. That was one of the biggest things on the reset, was learning that. Understanding your body, when you put the best fuel inside your body, you're going to burn it as a fuel. When you have a food, like an egg, like a steak, okay? A hamburger without the bun, bacon. It's so nutrient dense, okay? Cheese. It's so nutrient dense. Butter, nutrient dense. You got little mitochondria inside every cell in your body. Well, you got lots of them. They're battery packs. And your batteries go, hallelujah, you're giving me fuel. You always gave me the wrong fuel. You were loading me up with carbs that burn too fast. That burn too fast. I like this slow burning Guys, you know my illustrations over the years. Pretend you're a wood stove. Paper? That's a piece of bread. That's a muffin. That's a bagel. I don't care if it's whole wheat. It's a piece of paper on wood stove. Is paper good to heat your home? Not really. It can help sort of start the fire. Yeah. What's better? A log. Meat. It's a log on the fire. Cheese. Dairy. It's a log on the fire. An egg. It's a log on the fire. What do you think your body loves? Yes, nutrients. Your battery packs, nutrients. It supercharges the mitochondria. Therefore, what happens, you're releasing an output out of your mitochondria. You remember this from high school. Your ATP. Your biology in high school. ATP, that's the fuel the mitochondria produce. But it's all based on what you're eating. You see, the reason for my madness? Guys, I've been preaching this since the days of Noah. The world went stupid. I saw it happen. They went fat-free. Fat. It makes you fat. Don't have cholesterol, because that's gonna clog up your arteries. Said stupid. And even today, here we are. They're still preaching it. Right? But I'm not a Lone Ranger anymore. I used to be. I'm not a Lone Ranger. There's people that are starting to catch on. They get it. Well, it makes sense. Since when is cholesterol the boogeyman? You go up with the Inuit, maybe not today because they're westernized. The day you bring McDonald's, I hate to pick on them. No, but the day they eat the way we do, they lose it. But people, this happened. People live with the Eskimo, the Inuit. They didn't get back in time. The ships didn't come to get them, and they had to stay, and they spent the whole year with the northern tribes, and they go, holy smokes, these people are so healthy. We can't get over it. Yeah, but they live on blubber. They live on seal meat. And they eat all the fat. As a matter of fact, the muscle, they throw it to their dogs. They know where the fat-soluble vitamins are. Now, they haven't written any books. But we've written books based on what we've seen of those people and their diet. Fat don't make you fat. Fat don't clog your arteries. Sugar does. Crappy carbs. I don't know why I got on that tangent. Oh, that was Chaz asking how we burn fat. That's how you burn it. Eat it. And your body will burn it. You got to eat. Right? You have to eat. Okay. This is Andrea. Hi, Andrea. Recently had a live blood analysis done, and I was told that my red blood cells are sticking together. They call that the rouleau. Let me ask you a question. I know you can't answer me live, but I used to teach live blood analysis, okay? I taught practitioners. I gave courses on how to do it. You got to be careful with live blood analysis, okay? I used to tell my practitioners this all the time. Remember, it's a tool in your toolbox. It's not everything. It's not everything. It's a tool in your toolbox, okay? So you're looking at blood. I think every doctor, you go to any physician, they should have a microscope, take your blood and look at it live because it is good. It's a good indicator. Rouleau, I know it's there, but it depends. You're going to have a rouleau 100% for sure if you didn't fast before taking the blood test. Okay? So before they prick your finger, were you fasting? At least 4 to 6 hours. Why? Because if you have food inside the blood, your cells are going to stick together. So rouleau, I know, I like I said, I never got too uptight with rouleau. I really didn't, okay? I was more interested in if I saw mast cells, M-A-S-T, white blood cells that were indicative of allergies. I looked for candida. I looked for the count. I used to like just doing a visual count because I saw a lot of people with red blood cells that were way too large. And they didn't even know it, but they had a form of anemia. I could tell that. I could tell if they had an infection. I could tell if they had too many white blood cells. I could tell. I used to tell patients, hey, you see that little bacteria there? Yeah, I see that. See the white blood cell chasing it? Yeah. I said, that's your immune system. And it only works if your vitamin D levels are good and you're avoiding sugar, because that'll put that white blood cell to sleep. But to answer your question, Andrea, I don't care too much. I was told that my red blood cells are sticking together and nattokinase was recommended. No, I don't get too uptight about that. I know some practitioners. I guarantee you that practitioner was not trained by me. Drink water. A lot of people, I could tell, man, your blood is like molasses, man. You're not drinking enough water. Okay. Anyway, I don't get into the potential causes of the rouleau too much. Okay? Anyway, that's me, Andrea. And I'm right about it. Okay. Gail, why do you experience headaches? Why do we experience headaches if we go off coffee for more than a day or so? Because you're addicted? I don't get a headache. I just go, why would I do that? Why would I stop drinking coffee for a day? You can't give me one good reason. It's got 1,000 phytonutrients. Why would I ever stop it? And, good for you if you get a headache if you stop it, because you shouldn't stop it. Why are you stopping drinking coffee? I had my radio show for years. I used to say that. Well, Doc, it must be a drug because if I don't take it, I get a headache. No, your body's giving you a slap across the head. Why are you not having your coffee this morning? Slap across the head. That's why you get a headache. Coffee's not a drug. It's a phytonutrient. 1,000. They counted. It's the real vitamin C. Real. It's the best. You know what I tell you? You know what the best fiber in the world is? Not fiber, it's coffee. It acts like metformin if you have it with a meal. Lowers your blood sugar, increases your glucose uptake, helps you with insulin resistance. Proven. I'm not joking. Oh, Patricia, this is okay. I answered this the other day. I lost 30 pounds away in Italy, but I thought you went to Italy for a couple of weeks, Patricia, and I thought you lost 30 pounds. I was concerned about you. How do you lose weight going to Italy? But you were there for 6 months, weren't you? Or close to it. And you ate good and you walked all over the place, I bet you. I always said, I live with an Italian. How do you lose weight? Okay. I call her my Italian stallion. Okay. Guys, I think I answered everything. If I missed you, let me know. Okay? Okay, we love you dearly. And sincerely, we've got a great week coming up. Thanks for watching this morning on Holiday Monday. We appreciate it. And you have a great Labor Day. Enjoy. Hey, can you believe the summer's coming to an end already? My word. I can't get over it. Love you. Talk to you soon.